that there can be a lot of confusion between what is palliative care and what is hospice. And some people, even doctors, might use these terms interchangeably. When you think about palliative care, I want you to think about a whole umbrella of care that can be helpful from the moment of diagnosis with a serious illness. If you think about someone who was diagnosed with pancreatic cancer, it's a very sad and serious situation. The palliative care team may not be very active in the patient's care because the patient is aggressively seeking disease-directed care like chemotherapy or radiation. But after some time, in some patients, they may not respond as well to the chemotherapy, or they may have more side effects because of the cancer. Maybe they have pain, or maybe they have nausea. A palliative care team might be really helpful to help look at addressing those symptoms. Maybe they could be helpful in supporting the patient's spouse or kids as they're dealing with this difficult diagnosis and seeing how the patient isn't able to do the things they used to be able to do. Over time, perhaps the chemotherapy is less responsive. The cancer has grown. The patient doesn't want to go back and forth to the hospital so much. The palliative care team has become more actively involved in this patient's care than even perhaps the oncologist at this point. Upon conversations with the patient and their family, they may make the decision to transition to hospice care. Hospice care is appropriate when a patient has an advanced illness and has a philosophy that they don't want to seek aggressive care for that illness. They would rather focus on addressing their symptoms more aggressively and helping manage their comfort. Transitioning to hospice is not giving up. It isn't throwing in the towel. What I like to say is it's just changing the fight. A lot of people tell me, "Doc, I'm a fighter. I'm not going to give up." And I say, "You're not giving up. It's fighting for something I think we can win. We might not be able to win the battle against your cancer, but we can really win that battle on better days and better pain relief and supporting you and your family." And so hospice care is a subset of palliative care that is particularly for those patients who are ready to reframe that fight. Care is most often where the patient lives, and the patient doesn't have to go back and forth to the hospital or other doctor's visits anymore. The medications become dedicated to managing the symptoms and stress of the illness, and the hospice team walks with the patient and their loved ones to the natural end of their life.
So there's a big difference between hospice and palliative care. Both of them will focus on the physical needs first and foremost, because if you do not focus on the physical needs and managing the symptoms, then the patient's attention is always on, whether I'm sick, whether I'm in pain. If we can get those symptoms under control, then we are able to focus on those end-of-life tasks, which bring peace. If they can complete their end-of-life tasks, they will have a more peaceful death, and we often need to use less pain medicines and anxiety medicines.